Thanks so much for your patience. We have folks joining us from across the country and around the world, so we wanted to give everybody a little extra time to join in. We hope, regardless of what time it is where you live, you've been having a great day so far, and we thank you for your time and attention in joining us today. So, my name is Jeff Main. My pronouns are he, him, and I am the Executive Director of Point of Pride. Before assuming the ED role in July of 2023, I was the co-founder and previous Board of Directors Secretary for Point of Pride. I've been with the nonprofit for over a decade, leading and growing the organization, especially overseeing the programs and cultivating relationships with donors and other nonprofit partners. Prior to taking on the ED position, I had a background in marketing and design at an agency. I currently live in Philadelphia with my wife, our toddler, and our cats. Toddler is to bed, but a cat is likely to make a cameo at some point during today's presentation.
Hi, my name is Tyler, he, him. I've been working with Point of Pride as a volunteer since 2017 and was officially onboarded as the program manager the first of the year. Those of you who have interacted with any of our programs before have probably gotten an email or three from me. A lot of people know me as the email guy. Inside the organization, I'm more the spreadsheet guy. And before coming to Point of Pride, I worked in the healthcare industry for the last 15 years, primarily in pharmacy and insurance.
So while today's session is going to focus entirely on our annual trans surgery fund, our organization offers financial aid and direct support through some other programs that we wanted to quickly share with you in case it's helpful. We also offer an HRT Access Fund, which provides direct financial assistance to trans folks who cannot afford gender-affirming hormone replacement therapy. We offer an electrolysis support fund, which provides direct financial assistance towards permanent hair removal services, including electrolysis and laser hair removal. We also mail free chest binders and femme shapewear to trans folks who need them entirely for free. And across all of our programs, we have served thousands of trans people in all 50 states and 110 countries and counting. Each program has its own application process, timeline, and details, which you can learn more about on our website, www.pointofpride.org. So today's agenda. We're going to talk about the program itself, note important dates around when we can accept applications, and then we're going to do a deep dive into the applicant experience, what our reviews process looks like, what our recipient experience looks like, and we're going to end with an open Q&A. There is no need to screenshot while we go through or worry that you might have missed something. This deck is going to be shared with you in an email after the info session concludes, and we're also recording this session to share it to our YouTube channel that you can access after the fact. If you have a question and you'd like to ask it right away, there's no need to wait for the open Q&A. Tyler is going to be monitoring the Q&A, so please feel free to ask questions at any time, or you can save them for that Q&A at the end. So here we go. About the annual Trans Surgery Fund. This is a scholarship-like program that provides direct financial assistance to trans folks who cannot afford gender-affirming surgery. Over the course of the history of the program, we have awarded $620,000 to 63 recipients. We're very excited that for our 2024 cycle, this next application cycle, we are anticipating awarding between 60 and 80 recipients. So this will be more recipients in a single cycle than in the entire history of the program. So we want to pause here and recognize, very importantly, that access to healthcare is a right that every person, trans or cis, deserves. And that said, heartbreakingly, we still have limited resources, and the Surgery Fund is a competitive program. With the volume of applications we anticipate we'll receive, somewhere between 2,000 and 3,000 applications, we expect the award rate to be about 3% of everyone who applies this cycle. So what are our requirements to apply? We require that you identify as trans, and by that we take a very broad definition. of the trans umbrella. So if you identify as not cis, you are eligible. We require that you are 18 years of age or older at the time of your surgery. So you don't have to be 18 in November, which we'll get to in a second when you're applying. You could be 17, but we do require that you would be 18 at the time of your surgery. You have financial need that prevents you from affording gender-affirming surgery, and you can demonstrate past attempts at affording care. And so by demonstrating past attempts at care, our reviewers want to learn what steps you have taken in your healthcare journey, and that you fully understand the financial roadblocks or other roadblocks unique to your situation, and that you've exhausted different potential solutions to overcome those challenges. So, this is going to look very different for every applicant. It can look like research or action taken towards health insurance, towards financing, appealing an insurance denial, or financial decisions that you've made to fundraise for your care, like taking on an additional job, launching a GoFundMe or another type of fundraiser, and so on. We require that you complete your surgery in the United States with a US-based surgeon within 18 months of confirming your award. So this is an international program, and we'll talk a little bit more about what international applicants can expect. But due to our 501c3 nonprofit status, we do require that surgery takes place with a US-based surgeon. And we require that your surgery takes place on or after March 1st, 2024. And this is a strictly logistical thing. It's going to take quite some time for our reviews process to complete, which we'll get to in a second. And so we're simply unable to award recipients ahead of that date. Eligibility. You can apply for any gender-affirming procedure. And so by that, we mean if it affirms your gender, it is eligible. For surgeries that are multi-step or consist of several procedures, like facial feminization surgery, this grant will cover only procedures that can be performed on a single surgery date. So another way to think about that is a single trip to a hospital or surgical center, a single time under general anesthesia. You can apply regardless of employment, housing, disability, or immigration status. And you can apply regardless of whether or not you have health insurance. And with health insurance specifically, we do not have any requirements like you should have needed to have attempted coverage in the past, that you might have already received a denial letter or anything like that. We recognize that there can be many scenarios in which you might have inclusive healthcare coverage and still cannot utilize that coverage. You can apply regardless of whether or not you are on hormone replacement therapy or taking other steps in your transition. Your surgeon may have their own certain requirements, but our program does not. And you can apply whether or not you have already received funding or support through any of Point of Pride's programs. Applications are open for the entire month of November. So we're going to open on Wednesday, November 1st, and close on Thursday, November 30th at 11:59 p.m. Eastern Standard Time. This is a hard deadline. Absolutely no applications will be accepted after this date. When you apply, so whether you apply on November 1st or November 29th, has no impact, positive or negative, on your likelihood of receiving funding. And as a reminder, if you have already scheduled a surgery, it must be on or after March 1st, 2024, simply because of the amount of time we expect it will take to review all applications. For international applicants, you are welcome to apply to the Surgery Fund if you live outside of the United States. As I mentioned, due to our nonprofit status, all surgeries must be performed in the United States and its territories. That means in order to apply, you have to be physically and financially able to travel to the United States for your care. And at this time, our grants cannot be applied to travel, lodging, or other logistical expenses. Our grants are paid directly to your healthcare provider. So as I mentioned, your eligibility to apply to the fund is not affected by whether or not you have health insurance. However, if you do have insurance, we kindly ask that you consider your level of access to gender-affirming care and explore if utilizing your insurance coverage is an option before you apply. So we're going to drop these two links in the chat for y'all to review and bookmark and check out at your convenience. These articles are available on our blog, and they're also going to be in that email that you'll receive at the conclusion of this info session. The first article is how to approach getting insurance coverage for a trans surgery. And the second is my insurance has denied my gender affirming surgery. Now what? And both of these resource guides aim to give you the exact language and step-by-step process so that you can navigate both of these things, a little bit more easily. So now let's talk about the applicant experience. When you apply, you have the option to name a support person. So for help as you navigate our application process, you may list someone else on your application as your liaison, translator, or general support person. So your support person can be a friend, a chosen or blood family member, a counselor, a social worker, really anyone in your life who you trust, who can help you navigate this process and submit a high-quality application. This person will be CC'd on all email notifications regarding your application status, and access can be revoked at any time by you, the applicant, simply by contacting us. We also want to flag that support people are also able to apply within the same application cycle, so you can be both an applicant towards your own care and a support person to another applicant. We have an instruction packet that's available on our website. Likewise, this link will be in the email that you'll receive following the info session. This document walks you through every question on our form and explains what our reviewers are hoping to understand about your unique needs. So you'll see on the right-hand side of this slide a screenshot of what it looks like in explaining the short answer responses, which we'll chat about in a little bit. And so we're trying to explain to you, some idea of what our reviewers are looking for. And then we're also providing some bullet point examples of things that you might consider about your own situation in crafting your short answer responses. So we do recommend that you review this instruction packet, consider or even draft those written responses ahead of time. Many applicants have told us in years past that writing their responses ahead of time was really helpful. It gave them that opportunity to think carefully, review, and edit before submitting. Our application form will ask you for basic contact information, optional demographic information, information around your surgery, such as the type of procedure you're seeking, whether or not you've identified a preferred surgeon, and just some other logistics about your care. And then short answer responses to demonstrate your financial need and your past attempts at getting care. And again, each of these questions are explained within that instruction packet I just mentioned. The form itself is hosted on JotForm. This is a secure HIPAA-compliant platform. We also store all data that you share with us following privacy best practices. More information about that can be found on the privacy policy on our website. Some notes. Grant awards vary widely, and they vary widely because they're personalized to your unique needs, your existing savings, your health insurance status, and many other factors. So historically, the average award has been about $9,000. And again, that's the average across all of our recipients. Some recipients have smaller award packages, some have larger award packages. We expect that in 2024, that average award amount will be a little bit higher, probably between $10,000 and $12,000. The way the fund works, or the aim that we have, is that your grant would cover a high percentage, somewhere between 70 to 97% of your total surgical anesthesia and facility fees. So therefore, you would be responsible for a smaller percentage of your care, between 30 and 3%, with a maximum out-of-pocket expense that would be specified in your unique recipient agreement. And so just to clarify there and provide a little bit more context, when we say maximum out-of-pocket expense, we're talking about the amount of your healthcare bill that you would be responsible for, separate from health insurance, if that's applicable, or Point of Pride's contribution via a grant. So it's not set in stone across all recipients because of that number of factors I mentioned. A top surgery that costs $10,000, for example, might have a much lower maximum out-of-pocket expense for a recipient compared to a vaginoplasty that costs $40,000. But again, not set in stone and varies based on a wide variety of factors. Regardless of your grant size, you would be expected to cover travel fees, food expenses, time away from work, post-operative nursing care, pre-operative requirements like lab work, imaging, physicals, and some post-operative medications. All of those expenses fall outside of the scope of our grants at this time. If you are selected as a finalist, or if our reviewers determine they need additional information, you will be contacted via email. You may be invited to submit additional written responses or participate in a brief phone or online interview. If you are selected as a recipient, we will contact you again via email or phone regarding next steps. The full details of your award will be explained in your recipient agreement. And if you are not selected as a finalist or a recipient, we will notify you via email, and you are welcome to apply again during our next application cycle. So this is an annual program. That next application cycle would begin again November 1st, 2024. And a quick note that our team will store your application materials for 1 full year. And sometimes in the past, we've been able to pair additional candidates with financial assistance as we've received more grants, more financial resources, new opportunities. So there is a possibility that you might be contacted later in the year via email if that's the case. We have a full list of frequently asked questions on our website, but we wanted to make sure that we share the couple that we see most commonly with you right now. So what are the age requirements? Applicants must be at least 18 years old by your surgery date. There is no upper limit for age. Are there any weight requirements? So while Point of Pride, our surgery fund program does not have a weight requirement, we also recognize that many surgeons do. Therefore, it's your responsibility to meet any requirements set forth by your preferred surgeon, whether that's related to weight, mental health, or other WPATH requirements. Are there any additional requirements for international applicants? So not requirements, but international applicants will be asked a couple additional questions about your preparedness to travel to the United States. As a reminder, due to our 501c3 nonprofit status, recipients are required to travel to the United States or its territories to have surgery with a US-based surgeon. So on our application form, you'll have the opportunity to share any research or action you've taken regarding travel considerations, such as your visa and passport, transportation, and lodging. You'll note what you anticipate your post-operative care plans will look like, including who will accompany you for surgery. And you'll also have the opportunity to explain in your written responses whether or not you anticipate any challenges in traveling to the United States. Can the fund reimburse past healthcare expenses? So we understand all too well the challenges of debt and medical loans that so many of us in our community deal with in order to access necessary care. Unfortunately, no, the fund cannot reimburse past expenses. You must apply for financial aid towards a future surgery. This is because grants are paid directly to healthcare providers, specifically for the procedure itself before it takes place. Can you help me find a surgeon? Unfortunately, no. Our team does not have the expertise or ability to provide referrals or recommendations for trans-affirming surgeons. And there's a couple of reasons for that. But the main one is that every person's surgery goals and priorities are really unique. so many factors: a given surgeon's specialty or expertise, the procedure type that's right for you, whether or not you're willing or able to travel for surgery, means that finding a surgeon that's right for you is a highly individualized decision. You will be the best judge of who your provider should be. So we do recommend that you reach out to local LGBTQ centers or trans support groups, either in your area if they're available or online, as well as your current healthcare providers or insurance company if applicable, for recommendations to help guide your research. So now we'll talk a little bit about our reviews process. So as a reminder, there's no advantage to when you submit your application, whether it's earlier in the month of November or later in the month of November. As we receive applications, the first thing that happens is Tyler hides identifying personal information, such as your name, your email address, and your phone number. Your application then gets shuffled into a randomized packet with 49 others that are ready for review. These packets get distributed to our board of directors and our community grant-making fellows. These are specially trained grant-making volunteers. Every CGF personally identifies as trans, and in terms of that training, they're given periodic. So there's actually an initial training that they go through that really guides our rubric process and helps them identify, how our program works and how we select recipients. And then after that, they receive ongoing training periodically throughout the year. And so to minimize the impacts of unconscious bias, all of our reviewers follow a carefully designed scoring rubric and receive that continuing education I just mentioned. In addition, your application gets reviewed by at least 3 different reviewers, again, to mitigate any potential unconscious bias. We expect that it will take between 4 and 12 weeks from the end of the application window to review and select recipients. And again, it's a wide window, but we are expecting between 2,000 and 3,000 applications this cycle. And so for that reason, we expect 3% of applicants will be selected as recipients. This will unfortunately be a highly competitive process. You will hear from Point of Pride in late February or early March regarding your status. We recommend, if you are expecting that email and you haven't gotten it, that you check your spam filter, or something you can do right after this info session is add pointofpride.org to your safe senders list. This will make sure that any emails that come from Tyler or myself or the organization as a whole end up in your inbox as they should. So now we'll talk about the recipient experience. So if awarded a grant, you would get an email that contains a grant agreement. So you'll receive an agreement that explains the full details of your award. This agreement will contain your grant award amount. It will vary depending on the type of procedure you're seeking and your individualized circumstances. And as a reminder, in the past, our average award is about $9,000. We do expect in 2024 that average award will be higher, between 10 and 12, and that your grant should cover between 70 to 97% of your total estimated expenses. Your grant agreement will also explain the grant timeline. You'll be given a window of 18 months to schedule your surgery and utilize your grant. And so by that, you have a surgery date and your surgical invoice has been paid down to $0. Your surgery itself may take place later than 18 months. And we're quite flexible on that because we recognize that so many applicants might be the caregiver of a loved one, of a child, might have difficulty taking off from work, might have other logistical challenges, like their preferred surgeon might have a wait list. So we want to just, be aware of that it might take more than 18 months for you to be able to utilize it. In that email, you'll also be asked to review and complete some ancillary forms. There'll be a HIPAA disclosure form. This form names Tyler and myself as points of contact that can speak to your surgeon's office on your behalf to fulfill payments. And it's strictly for payment fulfillment so that you don't have to be the middleman in communication between us and your provider. You'll complete a support person disclosure. This form just confirms that you're still comfortable if you had named a support person during your application process, that you're still comfortable with them receiving any future correspondence around your grant award or payments or so on. There'll be a partner authorization form. So Point of Pride as a nonprofit builds partnerships with other values-aligned nonprofits that serve the trans community in being able to access healthcare. So these other organizations offer services like post-operative nursing care or free flights within the United States to access healthcare. So again, we don't directly provide these services, but we can refer you to our trusted partner organizations to learn more about those services if you so chose. Only in the event that you authorized this disclosure would we ever share personal contact information with any third-party organization. And then lastly, there'll be a media disclosure agreement. You see a screenshot of what that looks like on the right-hand side of this slide. You'll have the option to tell us exactly how your name, photos, and any other information may be shared publicly. And for your privacy and security, you can be as anonymous as you'd like to be. And we'll chat a little bit more about the media disclosure and public-facing content in a moment. For grant payments, the vast bulk of your grant award will be paid directly to your surgeon's office on your behalf. You may also be paid up to $50 in coverage for any post-operative prescription medications you might need, like pain medication. If you've been following our organization on social or just been browsing our website, you might have noticed that we share narratives of our financial aid recipients every time we award a new cohort of recipients. And so for these public-facing announcements, we encourage our recipients to write their story in a way that feels affirming and safe for them. So this means that many recipients choose not to publicly disclose personal or sometimes traumatic details that they might have shared privately in their original application. So in your original application, for example, you might share things about your disability status, your health or mental health status, your immigration status, or experiences of violence and discrimination. Anything you share with us in your original application stays private and does not have to appear in the recipient public-facing announcements. And that's because with so many mainstream stories that focus on trans hardship, we believe in allowing our recipients to have complete control over their story and, allow them to share what they want to help foster trans joy. So you'll see on the right-hand side of this slide that some recipients have chosen to use their photo. Some have chosen to have it blurred. In some instances, we select stock photos that represent a recipient's ethnicity, origin, or age, or other, personal factors compelling to them. And if you'd like, I invite you to visit our website and read through their stories for examples of what these announcements look like. Nothing ever gets published without your permission. So I want to take a moment and thank you all again for joining us today. When you leave today's info session, you're going to see a link for a quick feedback form. Please take a minute to fill it out and let us know your thoughts. It'll really help us in the future as we do info sessions like this one with other prospective applicants. So thank you in advance for that. We're about to go into our Q&A, but you can always connect with us by emailing us at surgeryfund@pointofpride.org, following us on Instagram, Facebook, or Twitter for now, or visiting our website at www.pointofpride.org. So even after today's session, if any other questions or feedback comes up, please feel free to reach out to us that way. And so now we're going to open up that Q&A. It looks like some folks have already been asking questions and Tyler's been busy responding. But please, if you have any questions, comments, or concerns, feel free to leave them in the Q&A. I see someone asked, would facial feminization surgery be considered a single procedure? So it depends. It depends on, the right procedure type for you and what your surgeon's recommendations are. Sometimes FFS is spread across multiple surgery dates. Sometimes it isn't. Our grants are limited to a single time under general anesthesia, a single trip to a hospital or surgery center. Someone else asked, would there be complications when submitting if I use my dead name and then legally changed it after submission of my application? No, no problems whatsoever. You would just update us of that. Not a problem. Does education status affect eligibility? Absolutely not. That's not a question we'll ask. Many applicants do share information about their education status, particularly if they're trying to illustrate other points or help our reviewers get a better sense of their overall picture, which is great. But your education status will neither positively nor negatively impact your likelihood of receiving funding in and of itself. I see a couple questions from multiple attendees today about how to make your application stand out. We'd really urge you to check out that instruction packet that you'll receive following today's session. We've spent a lot of time crafting it to try to give you the clearest picture of what our reviewers are going to be looking for when they're reviewing your application, and some of the things that you might want to mention. At the end of the day, our reviewers just want to have a strong sense of what your financial need and barriers are, as that is the most compelling sort of criteria point we use when evaluating applications. But we also want to understand, what action or research you might have taken to try to, get past those barriers. And I think just by giving us detailed, thorough responses, your application will stand out. We say this in our instruction packet. I want to be really explicit here. Our application form is not an English test. It's not a grammar test. We do not take that into consideration as well. So we're really just looking for those personal details, not identifying details, but personal details that help us understand who you are and the challenges that you're facing, and why you can't access care unless you had external help. Are you able to use a surgeon that's outside of the state that you live in? Yes. Many of our recipients and many folks in our community, either by choice or necessity, have to travel somewhere else in order to get the care that they need. So we have no limitations or eligibility requirements around that. Another attendee asked, are there any documents that Point of Pride prefers from a primary care physician to show previous attempts and approval or support from a PCP? So no, we actually will not ask you at the time of your application to upload any documents, whether that's letters of support from a therapist or a care provider, or letters of recommendation from someone else in your life. We have no requirements about that. Just through your written responses, if you want to share those things, those can be compelling details that show your level of preparedness and thought, like, I had a conversation with my doctor, or I'm trying to navigate the insurance process, or I'm reaching out to these surgeons. All of those things are more than adequate through your written responses. Tyler already answered a couple of these. I'm seeing some questions come in about eligibility with what a US-based surgeon looks like. So I'm just going to say it out loud for other folks too. If a surgeon sometimes travels to other locations outside of the country, does an exception exist for funding support for the surgery? And unfortunately, no. Our program does require that the surgery take place at the surgeon's US-based location, and that's just due to 501c3 nonprofit, federal guidelines and things like that. Another person asked, are there any limitations with doctors within the United States? Like, are certain care providers eligible and others aren't? And again, so long as the surgery is performed in the United States, which therefore means that the surgeon is licensed to perform surgery within the United States, there are no limitations. So we strongly encourage you to do that research and select the best surgeon for the results and the surgery goals that you have in need. Someone asked, does it matter how much savings you have already? Can I apply even if I don't have any savings yet? Yes, absolutely. Many of our applicants apply to the program with no savings. Many apply with even several $1,000s worth of savings. And again, your unique circumstances and what other financial barriers you have in your life are taken into consideration holistically. But yes, we do recognize that many of us have financial circumstances that make it such that saving is just not possible. Many of our applicants and recipients are also on assistance programs in which they can't save above a certain threshold without risk of losing their benefits. That's part of that continuing education that we train all of our reviewers on, so that they're also cognizant of that and there's no potential bias regardless of the amount of savings that you have in the bank. Someone asked, what are acceptable forms of proof to show attempt or desire for surgery in the past, such as dated social media posts, past prescriptions, examples of previous healthcare plans that didn't cover trans-inclusive care. So all of those are excellent and can be great examples of things that you would illustrate through your written short answer responses. Acceptable forms of proof is going to look different for everybody, and we do give some bullet points in our instruction packet on what that could look like. Sometimes it's, I talk to my primary care physician, my main doctor, about, my surgery goals, or I've done some research online, I've joined some groups, I've talked to friends. It can be, I spoke to the person that I trust to care for me after surgery. I spoke to my employer. I let them know I'm anticipating needing to take time off, in the next 12 months. It can look very different for every person. Again, we will not ask you to upload any sort of document or, physical proof of what that looks like. We're going to ask you in your application to just, through writing, explain what that looks like in your situation. Someone asked if the follow-up appointment after surgery is also covered by the grant. So typically the first couple of follow-ups are included within your surgical fee for the procedure. So your preferred surgeon would be able to verify that for you. But in the event that your follow-up appointment is not included, you would be responsible for those post-operative appointments. I see at least two attendees had asked about insurance coverage. So if my insurance will partially cover my procedure, am I still eligible? Does this weaken or strengthen my application? So if you know that your health insurance will at least cover your procedure, you're still eligible and invited to apply. In your application, you should be prepared to explain why your insurance coverage, what that partial amount might look like and why that's not adequate for your needs. And there are plenty of reasons why it might not be adequate, especially about high deductibles, right? They can vary so much. And earlier in the presentation, we had mentioned you might have very inclusive, excellent health coverage and still not be able to use it due to deductibles or other factors in your life. Whether or not you have health insurance whether or not you know if they'll cover part or all of your procedure will not positively or negatively impact your eligibility to apply. We just want that color about your situation in your written responses. So I see someone asked, do we need to state exactly what type of surgery we're looking to have covered? If so, are there any particular types of top surgery styles that are more likely to be covered from a financial standpoint? I know that coverage amounts are variable. So right, just curious on what that looks like. So yes, in our application form, there will be a question. It's a single radio select form input where you'll select what your procedure is. We have a whole list of a dozen to 2 dozen common options. And then we have an other where you can write in the procedure that you need if it's not already listed there. So top surgery is one of those options. We do not have, or let me say it this way, the type of top surgery procedure that you might be seeking specifically does not impact your likelihood of whether or not you would be funded. We do not, and that's true of any other type, right? So facial feminization, if you know exactly what sort of procedures you're having within that already, techniques for bottom surgery, for any type of surgery, we do not put emphasis on likelihood of funding one way or the other. Talking about, I've done my research, I've spoken to surgeons, I've decided that keyhole style top surgery is best for me and my surgical goals. That's a great way to illustrate preparedness, but it will not affect your likelihood of funding. Someone asked, could MTF, male to female feminization procedures, be combined, such as facial and body contouring happening simultaneously, like some surgeons practice? Yes, if those procedures are happening simultaneously, so that's one trip to a hospital or surgical center. That's one time underneath general anesthesia, one surgical invoice. Yes, absolutely, that would be considered a single procedure, and you would be eligible. I see someone wrote, if as a plus size person, we want or need extra liposuction to avoid dog ears underneath our arms, will this be considered out of pocket or part of the grant coverage? So if liposuction is needed by you, recommended by your doctor, in a consultation, maybe that's something you're not thinking about now, and later your surgeon recommends that for your unique circumstance. And it's happening at the same time as your other procedure, it is part of the grant. It is not considered a separate expense. If you have surgery utilizing this grant and there is a surgical complication, or down the line you seek a revision, unfortunately our grant is not designed to cover those future expenses. You would be welcome to reapply during our next application cycle towards any future revisions towards your original surgery. Someone asked, does Point of Pride have any mental health requirements at the time of application? So no. Again, your chosen surgeon might have their own requirements around weight, mental health, whether or not you're on hormone replacement therapy. They might have their own age requirements. We do not have any requirements like that. Someone wrote, with some quick research, I noticed that some states' Medicare doesn't explicitly cover or exclude gender affirming surgery. So am I right to assume, whoops, I think Tyler beat me to it. 1 second. Am I right to assume that Medicare eligibility is a query for a for a healthcare provider? So yes, you should definitely discuss with your surgeon whether or not they'll accept your insurance, regardless of the type of insurance. So whether it's Medicare or something else, they should be able to help you navigate those insurance questions. You can also use some resources that we have available on our blog. I believe, 2 of which I had mentioned will be linked in the info session. To the attendee that asked this question, I see Tyler also specifically dropped you those links. But for other folks that are hearing the question, if you check out our blog and sort articles by our surgery fund, you'll see some of these resource guides.
I've dropped those links in the chat again as well.
Great. Thank you, Tyler. I am seeing Q&A questions are slowing down quite a bit. I think we'll wait 2 more minutes for any other folks that might have a question. Someone asked, what if I'm not able to fundraise on a GoFundMe because of my employment status? So great question. We touch on this in our instruction packet a little bit, or rather, we give several examples of this in our instruction packet. Many folks, depending on their employment status, if they're government officials or otherwise, might have requirements that they can't start a GoFundMe or fundraise in a specific way. If you note that in your written responses, that will be super helpful for our reviewers because it will show that preparedness, right? That you've thought through some of these barriers, such as you can't fundraise in a specific way. So we know that's also true for students. Certain students are not able to, fundraise or take on additional jobs because of work study requirements. It's certainly true for folks that have specific immigration statuses or are asylum seekers. There's all sorts of barriers that come up there, as well as your disability status or even your stealth status. Launching a GoFundMe might not be an option for you if for privacy or safety, you need to remain stealth. So someone asked, whoops. Let me grab that question. Someone asked, if we are selected as a recipient, will we have the opportunity to share our success story through Point of Pride? So yes, so you'll have the opportunity to share that recipient announcement at the time that you're named a recipient, which again is written sharing whatever details you'd like to disclose about your journey or looking to the future. And then we also check in with our recipients periodically just to make sure, A, you have no questions about your grant award and you're moving confidently towards the surgery that you need and deserve. And B, we just want to see how you're doing. You'll have the opportunity to share those, testimonials or feedback with us If you follow us on social, you might have seen sometimes we share updates. Some recipients will share with us photos of them post-op, whether that's selfies or shirtless top surgery photos, specifically to share that with the broader community and help foster that trans joy. So you certainly would have that option, and we always welcome updates like that from the people we serve. So someone asked, can we submit the application in Spanish? So yes, if English is not your native language, we invite you to apply in whatever language is native or most comfortable for you. We'll ensure that the application gets translated or is assigned to reviewers that speak that same language. Again, all of our reviewers identify as trans and have received that training that we chatted about earlier. Additionally, if you'd prefer to submit an application in English and list someone as a support person, many folks do that instead, and their support person is someone that offers translation services. So you can think about which of those options is best for your circumstance or feels most comfortable for you. Someone asked, how is the application review process conducted and what specific criteria are used to evaluate these applications? You might have joined late, maybe not. Regardless, there is a section of this deck, which will be emailed to you later, that talks about that reviews process. Applications are accepted the month of November. We expect it will take between 4 and 12 weeks. Excuse me 1 second, I have a meowing cat. I did warn you all that someone was going to make a cameo, and it's my cat. Excuse me, though. So yes, there will be a period of 4 to 12 weeks in which our reviewers, who are a mix of our board of directors and our community grant making fellows, these are specially trained volunteers, review every single application. Your application is reviewed by at least 3 different reviewers to ensure a fair and complete review and mitigate any potential unconscious bias. And the criteria that we use to evaluate these applications is explained in our instruction packet, which will be emailed to you after this info session. The main criteria that we want to understand is your financial need and how, without support from an external funding support source like our program, you would simply be unable to access the care you need and deserve. And we will ask you to demonstrate either past research or action that you might have taken to accessing that gender affirming care. All right, great. I'm not seeing any more open questions. I think we'll give 1 more minute for folks. All right. Thank you again, everyone, for joining us for today's info session. Again, if you have any questions following today's call, please feel free to reach out to us directly. If you email surgeryfund@pointofpride.org, it goes straight to Tyler. You can also message us on social media. And when you leave today's info session, as a reminder, you'll be asked to take a very brief feedback form. Thank you in advance for sharing your thoughts with us. All right, great. Have a great day, everybody. Take care.